Assalamualaikum. My name is Muhammad Mukris bin Majid and from DMI 31, and my matrix number is 41412120002. And today I will present about the catheterization laboratory machine. For angiography, cath lab is a cardiac catheterization and lab machine. This machine is used to perform the invasive diagnostic and sophisticated cardiac operation in order to diagnose and treat the cardiovascular disease. A catheterization laboratory also used in the interventional radiography procedure, which are for stenting or also known as the angioplasty at the artery and the chamber of the heart. In the cath lab also have the X-ray, fluoroscopy, MRI, CT scan. But for this cath lab machine, basically this machine same with the C-arm, and the procedure we want to talk about for this machine is the fluoroscopy. Fluoroscopy is the machine is the medical process that creates a real-time movie of the movement inside a body by passing X-ray through it over a time. Then I will talk about the structure. At first, a movable operating table is a function for a patient with lie flat on the cath lab table, which will able to the move around and to allow the imaging cameras to circulate around the body and also change the view of anatomy. Furthermore, at the cath lab also have a C-arm, whereas C-arm have an image intensifier above the patient and X-ray under the table. Image intensifier is a complicated device gadget that receive image forming X-ray beam and converts it into the high intensity visible light image. Then in the X-ray tube housing have a tube housing that shade and absorb the radiation except the radiation pass through the window. Meanwhile, at the final image intensifier can provide a field of vision that is up to 50% larger than a similar class of image intensifier. Then in the cath lab, mention also 4 and the 6 monitoring screen, which is the function is placed for workstation and display the view of the movement of a contrast in the vascular. Next is the operator station. Operator station is usually isolated from the patient at large injector pump to achieve the opacification for these diagnostic techniques, which need a high flow, high volume, fixed rate injections delivered at relatively high pressure. For this power injector were used. So this is a structure in the cath lab, which is a cath lab is a same function with the C-arm, just have a different features. It is comparable to the C-arm except the mounting system, which are the table rather than a mobile system. It also provide more powerful than a mobile C-arm. Following that, I will explain about the function. For visualize, the function is visualize the move the contrast in the arteries, and call to inject the contrast is the catheterization. That's why the full name is the catheterization laboratory. In the arterization, in the catheterization, there is not only for diagnosis but is also of a treatment. Well known as the angioplasty is a procedure inside the balloon to treat the stenosis and blockage. Furthermore, is the primary percutaneous coronary intervention (PPCI), which is a treatment of the acute myocardial infarction and also procedure to treat the narrowing arteries. Additionally, this machine also used for implantation. The purpose of the implantation is for the surgical placement of a tiny electrical device in the chest. Last but not least, cath lab machine is also used in the ablation, where method of the restoring a normal cardiac rhythm, particularly if a medicine has not corrected the irregular beat. Then this is the radiography appearance in the cath lab, and this is the reference that I got from this machine. That's all from me. Thank you.